Hi, Jonathan. My name is Terry. I'm one of the parishioners here at Fullerton Community Church. Nice to meet you. How are you
Nice to
doing?
meet you. I'm doing well, thank you.
Okay, that's good to hear. I'm just gonna give you a little background about our church. It's a faith community church, so we're very involved. We have like support groups. We go out to the hospital setting, especially in the oncology department. We have a lot of cancer patients, and they really need a lot of support.
Of
And then
course.
also with our church, we do food drive and stuff. There's
Mhm.
just a lot going on at the church, so we need all the help we can get.
Of
So
course.
we have one opening for our parish nurse.
Hmm.
So we're hoping to see how it goes with you, and we do have another person that's interviewing after you. And
Okay.
just to let you know, um, in the Zoom meeting, we're having the Zoom meeting since we're in the COVID pandemic, so that's why we have the Zoom meeting. And along with me, I have Taisha here. She is also another parish nurse. Do you want to say anything, Taisha?
Hi, Jonathan.
Hi.
I am Carrie's assistant. I've been assisting for with the church for 5 years. I've actually
Wow.
been in the business for 10 years.
Wow.
And I would love to interview you today. And I'm happy you came to our church. Thank
Yeah,
you.
thank you so much. I'm looking forward to getting to, um, getting the opportunity to interview for this position, the parish nursing position, and I'm really excited to be here today. Thank you.
Well, we look forward to getting to know you better. So I'm going to start out with some questions. There's 10 questions.
Okay.
Five of them are going to come from me, and then the other five will come from Taisha, okay? So
Okay.
I will get started first. First question for you. What is your definition of parish nursing?
Okay. So I believe parish nursing is the practice of providing holistic care to individuals and families within a faith community. It involves addressing physical, emotional, and spiritual needs and promoting health and wellness within our community.
Okay, so second question, what is your experience in providing care for individuals and families within a faith community?
Okay, so I have 2 years of working as a nurse within a faith community. In my previous role, I provided care to patients in a church-based clinic and also conducted home visits to patients who were unable to come to the clinic. I have experience providing spiritual care and support to patients and their families, as well as developing and implementing health education programs within our community.
Okay, that's good to know.
Mhm.
Third question, how do you approach spiritual care and support for patients and their families?
So, I believe that spiritual care is an important aspect of overall health and wellness. I approach spiritual care by actively listening to patients and their families, addressing their spiritual concerns and needs, and providing emotional support and guidance. I'm also respectful of patients' diverse beliefs and practices and ensure that the care provided is in a manner that is consistent with their beliefs.
All right, that's good to know. So let's go to the fourth question. What is your approach to addressing health disparities within a faith community?
Okay. So I believe that addressing health disparities involves understanding the unique needs and challenges of the specific community and collaborating with other healthcare providers and community organizations to develop targeted interventions. I would work to identify the specific health need in the community and develop culturally appropriate programs and initiatives to address those specific needs.
All right. Okay, last question from me, and then
Okay.
I will pass it on to Taisha, okay?
Okay.
Can you share an experience where you successfully collaborated with other healthcare providers to meet the needs of a patient?
Of course. In my previous role, I collaborated with healthcare providers to develop a care plan for a patient who had multiple chronic conditions. We worked together to identify the patient's needs and develop a plan of care that included medication management, physical therapy, and spiritual support. Through our collaboration, we were able to improve the patient's health outcomes and ultimately their quality of life as well.
All right. Taisha?
Hi, Jonathan. So I'm going to ask you a few questions as well. How
Okay.
do you handle difficult conversations with patients and their families at the end of life care?
Okay. So, as a parish nurse, it's important to approach end of life conversations with sensitivity and compassion. I would start by actively listening to the patient and their family members to understand their concerns and their needs. I would then provide them with accurate information about the condition and the prognosis, as well as different options for end of life care. Ultimately, the decision should be made by the patient and their family, and I would support them in whatever choice that they decide to make.
Okay. Can you give me an example of a health education program you developed and implemented within a faith community?
Yeah, of course. So, one health education program that I developed and implemented within the community was a diabetes management workshop. I worked with the local diabetes association to develop the curriculum, which covered topics such as healthy eating, exercise, and medication management. We helped we held the workshop over 4 sessions and provided participants with practical tools and resources to help them manage their diabetes. The workshop was well received by the community, and we saw positive changes in the participants' blood sugar levels and overall health.
Okay, good.
Mhm.
How do you ensure patient confidentiality within a faith community setting?
Okay, so maintaining patient confidentiality is crucial in any healthcare setting, including a faith community. I would follow HIPAA guidelines to ensure the patient's information is kept confidential and secure at all times. This would include obtaining written consent from patients before sharing their information with other healthcare providers, using secure methods to transmit electronic patient records, and avoiding discussing patient information in public areas.
Okay. What do you believe are the most important qualities for a parish nurse to possess?
Mm, okay, so I believe that the most important qualities for a parish nurse to possess include compassion, empathy, strong communication skills, culture sensitivity, and commitment to lifelong learning. As a parish nurse, you work with diverse populations and provide holistic care that considers physical, emotional, spiritual needs of the patients and their families. It's also important to be adaptable and flexible as the needs of the community may change over time.
Okay. Can you tell me about a time when you had to make a difficult ethical decision in your nursing practice?
Yeah, of course. So, one time when I had to make a difficult ethical decision in my nursing practice was when a patient had a terminal illness, expressed a desire to end their own life. As a healthcare provider, I'm bound by the principle of non-maleficence, which means that I do not put my patients in harm. At the same time, I also need to respect the patient's wishes, their autonomy, and their right to practice and exert their own decisions. I consulted with the committee and the patient's family to explore all potential available options and ensured that the patient's wishes were respected while ensuring their safety and well-being. In the end, we were able to provide the patient with compassionate end-of-life care which met their health needs and wishes.
Okay, Jonathan, that was my last question. Terry,
Oh,
do you have anything to say?
No, I don't, but we do appreciate you taking the time for this interview. For now, me and Taisha, we have to come up with a decision, but the way you answered, it was very good. We like how you responded, but it's something we still need to discuss about. So we'll let you know. We'll contact you and let you know if you get the job or not. So,
okay,
yeah,
awesome.
Thank
Thank
you,
you guys
Jonathan.
so much for the opportunity. It was very nice to meet both of you today, um, especially over Zoom, during the COVID pandemic. I'm glad you guys were able to have me today, and I appreciate all your time and thank you for your consideration.
thank you again. Have a good
Thank
day.
you.
Bye bye.
Victor, my name is Terry. I'm one of the parish nurse here at the Fullerton Community Church. And here next with us in the Zoom meeting is Taisha. Just to let you know a little background on me, I've had 10 years experience here at this certain church. And we have a lot going on at this church, including food drive, support groups, um, going to the hospital to talk with patients. So we hope you're interested in being part of our team. And I will hand it over to Taisha for you to get a little background on her.
Hello, Victor. I'm Taisha. I'm Terry's assistant, and I've been in the business for 5 years. And I'm happy you came to interview with us today.
Hey ladies, ¿cómo estás? You know, how you doing? I'm like a broke boy, so like I'm totally interested in this job. And like, yeah, like nursing's so cool. Like saving lives is like the stuff, you know what I'm saying?
All right, Victor, let's get started with the interview, okay?
Mm-hmm.
Are you sure you're ready for the interview?
Yes,
Yeah,
we're
I
you,
think I'm
Victor.
ready, you know. I feel confident.
All right. You just look a little tired, that's all. Okay, so let's just get started. So, what is your definition of parish nursing?
Well, you know, it's like you know, you work in a church and stuff and you know, you save lives, you know.
That's it?
Yeah, you know,
All right.
I think that's it.
Next question. What is your experience in providing care for individuals and families within a faith community?
Well, like I've never worked in the faith community, but I work in the ICU and like I help patients not meet Jesus. You know, the spiritual stuff, that's for like the pastor, I think, right?
Okay. Moving on to the next question. How do you approach spiritual care and support for patients and their family?
Like I said, like that's not my job as a nurse. I'm for like the physical health. Like we could leave the spiritual stuff up to like the nuns and pastors.
All right, so I'm gonna have Taisha ask you a few questions, all right?
Okay.
Hi, Victor. So, what is your
Hello.
approach to addressing health disparities within a faith community?
What's a health disparity? Like, can you explain that?
Health disparities, so issues that like the vulnerable populations deal with, like living in poverty. How do they meet ends meet? And like not having health insurance, not having coverage, things like that nature.
Oh, okay, for sure.
Okay, sorry, Victor. Can you share an experience where you successfully collaborated with other healthcare providers to meet the needs of a patient?
Yeah, like, you know, on codes. You know, there you go. Saving lives, taking names.
Okay, next question. How do you handle difficult conversations with patients and their families about end of life care?
Oh, I don't gotta talk to patients about that. Intubated, sedated, and restrained, baby. You know what I'm saying? Like, no issues with that. And if they're gonna meet Jesus, like, I just call one legacy and like they sort it out. Okay.
Okay, Victor. I think that will be the end of
Oh,
our
are
questions.
you sure? Like, isn't there 10 questions or something? You know, like, don't you got more questions to ask me?
We have another candidate coming up, so we're gonna end this interview now.
Oh, okay, for sure. Thanks.
All right.
Thank you, Victor.
Your
Your
time.
time.
Bye.